Hi, this is Dr. Dean Kelaita, Health Officer for Calaveras County with a COVID-19 update for today, July 21st, 2020. U.S. fatalities from COVID-19 infection have now exceeded 140,000 since the beginning of the pandemic. California's confirmed 391,000 cases with 7,600 deaths. Calaveras County continues to experience a significant increase in disease activity. Public Health has now reported 94 confirmed cases of COVID-19 and our first death in Calaveras County in a District 4 resident over the age of 65. Hospitalizations have increased 33%, but we still have hospital and ICU capacity remaining. Most of the new cases in Calaveras County reside in the Jenny Lind, Valley Springs, Burson, and Copperopolis regions, and we believe that there's a larger proportion of residents who work and travel to adjacent communities such as San Joaquin County, Stanislaus, Sacramento counties with higher levels of disease than we're experiencing. People are bringing those cases home. 40% of our cases are considered community transmission, and 34% of cases are having been suspected of being acquired outside the county. To date, 3,692 tests have been performed on Calaveras County residents, and our positivity rate has increased to 4.4%, which is double what it was at the beginning of July. The average duration for test results to come back has now increased from 2 or 3 days to 5 to 7 days. Testing is currently recommended for hospitalized patients and nursing home residents and the employees who work there, symptomatic people, especially those at high risk, those exposed to a known or suspected case, healthcare workers, and essential workers. No-cost testing is available at the OptumServe Testing Center at the Calaveras County Fairgrounds in Angels Camp. The site's open Tuesday through Saturdays from 7 a.m. to 7 p.m., and reservations should be made on the website or calling the 800 number. That information is available on our website. Once a case is confirmed as positive, Public Health Contact Tracing Team will interview each person to assess where they might have gotten the infection from and who else they may have been exposed to, so those people can be isolated and quarantined, and testing can further be recommended for those individuals. Last week, Governor Newsom announced the statewide closure of the following business types to attempt to quell this outbreak: brew pubs and breweries, bars and pubs, indoor and outdoor, indoor dine-in restaurants, indoor winery and tasting rooms, family entertainment centers, movie theaters, zoos and museums, and card rooms, the indoor types of activities in those sectors. To better measure the severity of disease in counties, California maintains a monitoring process comprised of 6 metrics. Counties that fall outside of those metrics are placed on the monitoring list. These measures are the average number of tests run per day, the case rate as defined as number of cases per 100,000 population, the testing positivity rate, hospitals, ICU, and ventilator capacity. Calaveras County is not on the monitoring list. We're getting close on the rate of new cases we're experiencing and our testing positivity rate. For counties on the monitoring list, the following will happen: closing for at least 3 days of additional indoor business sectors where people tend to be more close and face coverings can be difficult. Those include gyms and fitness centers, places of worship, offices for non-critical infrastructure sectors, personal care services including nail salons, massage parlors, tattoo parlors, hair salons and barber shops, which can't be done outdoors, and indoor malls. Schools located within counties on the monitoring list will not be allowed to resume in-person student learning, as is currently scheduled to begin in most Calaveras County school districts starting in August. My goal as health officer for Calaveras is to keep our residents safe during this pandemic and to avoid us falling on the state county monitoring list. Here's how we do it. It's basic science. The best ways to avoid exposure to the virus are to stay at least 6 feet apart when you're outside your household. Wash your hands with soap and water for at least 20 seconds. Avoid touching your eyes, nose, and mouth with unwashed hands, and wearing a face covering over your nose and mouth when outside and around others. Wearing a face covering is an important tool in the fight to keep coronavirus in check, prevent further infections. It's not only up to us in those other areas of hand washing, but also wearing a face covering is a very important additional tool that we can use to prevent disease transmission, keep our community safe, and prevent increasing rates of coronavirus infection, and prevent us from moving backwards in reclosing certain sectors of our businesses and economy and allowing for the reopening of schools in the fashion that we've been discussing with the county, with the superintendents of the school districts, to allow for potentially reopening schools as early as August with a hybrid of in-person student attendance in classes and distance learning as well. And the school districts will announce further information as we get a little closer to the potential date for reopening some of our schools. But the key is we've got to keep disease rates from increasing. We've got to keep our percent of positivity of tests down, and we've got to wear masks, wash our hands, and do those everyday things that will help prevent disease transmission, keep our community safe, and allow us to get back to some semblance of normalcy, waiting for a vaccine or other drug therapies to come along and help quell this pandemic once and for all. Thank you for your support, and further information will be released to the community from the Public Health Department as it becomes available.